Hello, my name is Dr. George Rogu, and I am one of the many instructors for AdoptionEducationClasses.com, the Hague Certification Education Training Program. Today, I would like to speak to you about the topic, what is it about orphanages and institutions that make them hazardous to the health of the developing child? I'd like to speak to you first about the history of international adoption. In the 70s and in the 80s, a majority of the children that were adopted by foreigners was from Asian countries. These children tended to be of younger age, infant and toddlers. They lived in foster homes and small orphanages. The care that they had received was limited, and the information that parents received prior to the adoption was scanty at best. In the 90s to present, a good number of children came from the former USSR and other countries of the Eastern European bloc. These children, however, are a little bit older. They're toddlers, older children, and sometimes sibling groups. They had spent the majority of their young lives in an institutional care environment. These children have an array of medical and social issues that are a little bit more complex than the children from Asian countries, but their medical reports are laden with unintelligible neurological diagnoses. Families liked to adopt from these countries because videotapes were allowed and developmental milestones were able to be observed on this video footage. So the question always came up, is that neurological diagnosis something or is it nothing? Now, orphans. Who are these orphans? Few children today that live in orphanages are truly orphans by definition, which an orphan is a child that has no parents or they are deceased. Most children that are placed in an institutional care setting are basically abandoned by their families. They have a mother and a father somewhere out there, but they do not take care of these children. Most children are placed in orphanages and foster care for various social reasons, but the reasons seem to be similar internationally. The most common reason why children are placed for adoption is poverty. Single parenting follows. Then there's involuntary termination of the parental rights, alcohol and drug abuse by the mother or father, incarceration of the parents, mental deficiency, and lastly, death. I'd like to speak to you now a little bit about the history and the culture of orphanages. Historically, the beliefs and the attitudes of the society in which the orphanages existed determined how well run they were. So, if the country did not care about their orphans, obviously, they did not do very well in the orphanages, the children. Unfortunately, historically, orphan children were placed with society's outcasts, with the mentally ill, and with the handicapped. The reason this was done was to isolate them from the world. The people that took care of these children in these institutions generally lacked the clinical skills required to manage them. They lacked the education and financing required to care for these children was very, very limited. Now, the caregiver's overall attitude towards orphan children is very important because the psychological mindset of the orphanage caregivers and its medical director directly contribute to the future cognitive and emotional development of the institutionalized child. Now, I'd like to share some orphanage viewpoints that I've heard. Historically, in the government-run institutions, for example, in the old Iron Curtain Romanian orphanages, the attitude was, not even the parents wanted these children, so why should we care? Or, there must be something wrong, or there must be something defective with these children, otherwise they would not be here. Now, fortunately, we no longer have these attitudes. And in modern day orphanages, all children are considered valuable and children are innocent. Now, there are a lot of lessons learned from the past history of orphanages. And some of these lessons are that early social deprivation of children significantly contribute to the delay in developmental milestones. They contribute to a delay in the growth parameters. They contribute to a delay in the cognitive and academic abilities of these children. It contributes to the abnormal social and emotional development of children. And children that live in orphanages suffer a higher death rate in the first year of institutionalization. Now, the overall care of abandoned children is very, very interesting. We know that orphanages have an adverse effect on child development. Their mortality in orphanages increases dramatically, but unfortunately, for some populations, the alternatives are even more devastating. Now, there are some historical alternatives to institutionalization, and I'm sure that in some parts of the world, these practices still exist. There was the practice of infanticide, where historically in China, for example, if a girl was born to a family and it was a second, third, or fourth girl, rather than placing the child in an orphanage, they would just leave the child in a barren field exposed to the elements, and the child would die. Some children that are orphans are exposed to dangerous life on the streets. They become involved in crimes and gangs. Sometimes they were sold into servitude as laborers, servants, child sex workers. Some children were physically and sexually abused by the uncaring family members. And ultimately, there was early death of these children. Now, in the modern care of the abandoned child, we try to put these children in foster care. But even foster care has some advantages, but it is not without problems. Problems that we often see in children that are placed in foster care are multiple placements, there's psychological and educational disruption, there is a lack or a delay in health care and immunizations. Sometimes neglect and abuse occur. Internationally, foster care is not one of the common practices, but it is becoming more and more common, especially after a child is slated to be adopted. And we see this in countries like Guatemala and China. In the United States, however, foster care is very, very common, and I don't even believe that we have orphanages. Now, I'd like to speak to you a little bit about what are some of the medical risks that we see in institutions. Well, easy. We have a lack of general medical care. We have exposure to infectious disease. We have malnutrition and growth delay, cognitive and developmental delays, physical and sexual abuse, and correctable medical conditions. Now, I'd like to share with you some medical facts about orphanages. The first fact is that the severity of the medical condition is directly proportional to however long the child had lived in an institutional care environment, and that kids grow poorly in orphanages due to neglect and isolation from human contact. Now, in regards to lack and inappropriate medical care, we have a number of things that can occur. We have unrecognized medical problems just because there's nobody to take care of the problem. For example, I'm sure that children in orphanages that have a routine ear infection do not go to see the physician immediately. They linger on and on with pain and fevers for a while until a physician can come to the orphanage and take care of the child. And this is basically there because there's inattentive staff, or the staff is just plainly overburdened. There's the lack of funds to pay for medication and surgeries required, and some of the therapies needed. The mortality in the orphanages, unfortunately, is much higher than that in the general population. And I've seen that many orphanages have children with correctable medical conditions that here in the United States we wouldn't even think about as being a problem. For example, a cleft lip. A cleft lip is a defect that can be easily corrected. Unfortunately, in third worlds, the physician is not available, the hospital is not available, they may be too far away, there are no funds to pay for the surgery, so the child gets older and lives with this genetic defect. Sedatives are also given to children when they are in orphanages, and this is basically to improve sleep or modify their behavior. I mean, if you think about it, if you have to take care of 20 children, if you drug them up with a little bit of a sedative, they'll all be very, very quiet for a while. And unfortunately, even today, we have places where orphan children can be used for research, experimental research, without proper oversight by authorities. Now, the exposure to infection is very, very common in orphanages. And the reason being simple. You have a lot of little children living in a small environment, and they pass the germs from urine, feces, saliva. Children are germ buckets. They pass it on from one child to another. There is an increased risk to exposure to different types of more serious infections, and because these children tend to get sicker than the general population, the organisms that infect them tend to become resistant to therapy. Now, some illnesses that we see frequently in orphan children are tuberculosis, or a reaction to tuberculosis or exposure, intestinal parasitic infections such as Giardia, different types of parasites, rotavirus, hepatitis A. We have pneumonias, bronchitises, recurrent ear infections, gastroenteritis, and the list of infections can go on and on and on, from the mundane routine illnesses to the more significant ones like HIV infection. Faulty vaccine practices are another part of the increased risk of medical care to these children. The reason that there are faulty vaccine practices are simple. One, there is lack of routine immunization for these children, or two, there is the inappropriate storage and handling of vaccinations. Vaccines need to be stored at a certain temperature in a refrigerator, and that temperature needs to be monitored. There has to be a consistent flow of electricity in order to keep the refrigerators cold. Now, an orphanage that is in the middle of nowhere, that has a blackout, could you imagine the refrigerators that had all these vaccines that all of a sudden defrosted, but rather than throwing away the vaccines, they will reuse the vaccines because it's better to give a vaccine that may not work than not to give a vaccine at all. And because of these bad practices, we have outbreaks of childhood illnesses that we no longer see here. For example, chickenpox, whooping cough, measles. We had that epidemic of children that were coming from China with measles, diphtheria, and polio. Some countries, however, have implemented a very, very good vaccination protocol, but the bottom line, it comes down to finances. Vaccines are very, very expensive. If the child lives in an orphanage that is financially intact and supported by some outside authority, then obviously these children will be vaccinated. Now, the practice of over-medication and injections is another serious problem that occurs in orphanages, and it was common in orphanages of 1980s Romania. It was common to treat, for example, ear infections with an injectable antibiotics as opposed to oral antibiotics. It was also common for the healthcare workers to not sterilize the syringes, rather than just clean them with a little bit of alcohol and use it or reuse it on another child. And that's how they had in Romania in the late 80s the outbreaks of HIV infection and AIDS, hepatitis B. This practice also became common because the idea of using injectable vitamins in order to boost their immunity. IV gamma globulins were used to boost the immune system of the ailing child, and back then nobody used sterile needles. Fortunately, with the news and a lot of exposure, it's a well-known fact that we should never use unsterile needles, and most people do use the ready-to-use one-time only needles, but you never know. Now, the overall risk of the healthcare staff is also something that can put the children at risk. Many of the infections, for example, exposure to tuberculosis of these children, comes from an adult caregiver that has tuberculosis, for example, that coughs and exposes the children in the orphanage to this type of an infection. The reason this occurs is because we have a lack of infection control and hygiene practices. I'm sure in a busy orphanage where there's one caregiver that had to take care of 20 or 30 children, hand washing was least important for that person at that time. They would just take care of the children and move on to the next. This is how intestinal parasites are transmitted, positive PPDs or tuberculosis, hepatitis A, sometimes you had HIV, AIDS, hepatitis B, and hepatitis C infections. Growth delays and institutional dwarfism is another medical problem that we often encounter in children that live in institutions. There is a common known fact about orphanages. For every 3 months to 4 months that a child lives in an institutional care environment, there is a 1 month in growth delay. And the reason that we have these delays is because there is a deficiency in calories, proteins, and fats, and other micronutrients that these children take. Sometimes many of these children are depressed and sad, and because they're depressed and sad, this leads to a poor appetite. Sometimes they suffer from correctable chronic medical conditions. And the type of a growth chart that we see is similar across the board in general, and you can see this on the slide right now, where the height and the weight and the head circumference is below the 3rd percentile. Fortunately, I see routinely, after adoption, there is a rapid recovery in all growth parameters. And this can be exemplified through this growth chart. Failure to recover, however, in the growth parameters means that there is an underlying medical problem. Physical neglect is another part of orphan care that we often experience. There's a lack of hygiene and just routine medical care for these children. There is a lack of nurturing physical contact, which is particularly detrimental if this lack of care occurs in the early infancy period. We have the practice of bottle propping, which is used basically in order to feed many infants at the same time. Now, the risk that happens with this practice is that these children tend to have a lot of ear infections and are exposed to dental caries, and the infant misses out on a lot of the food-related human interactions, which are critical to the early emotional development of the child. I mean, by propping a bottle up on the child does not see the caregiver, look at the caregivers and the caregiver's reaction during the feeding. There's no eye contact. So this is detrimental, this practice. the lack of physical contact also leads to a self-stimulating behavior in the orphan child, which is exemplified by body rocking, unusual posture. And this occurs because basically the children are bored and they do not know how to soothe themselves. We also have problems with neglect. For example, children lack exercise and playing. Some children have never been outdoors. And the buildings that these children live in are usually very, very, very old buildings. And there's always the risk of exposure to lead. Now, in regards to some of the behavioral problems in the orphan child, I mentioned earlier the strange activities, such as the head banging, the head rocking, the shaking, the flipping, they just blankly stare at their own hands. Some children bite themselves and they bite others. Sometimes they have impossible temper tantrums and meltdowns. There's the indiscriminate friendliness, where an orphan child will basically latch on to any adult that shows any type of attention. Some children have pain insensitivity. They have inappropriate behaviors such as urinating and defecating on the floor in public places. There's hyperactivity, and a lot of these children have a post-traumatic stress disorder. Now, these responses may be considered a normal response to an abnormal environment. Developmental delays are also common. The reason that they are so common is because the cognitive function of a child is dependent upon its early life experiences and stimulation. Even children today that live in the cleanest and the most well-kept orphanages suffer some sort of developmental delays because of lack of outside world contact. These delays obviously improve dramatically once they are adopted and they are brought into a family unit. As I mentioned earlier, the children often never left the orphanage grounds for a majority of their life. The only times that they had ever left was just to a trip to the hospital, which was often a frightening experience for them. They often lack the experience of just going to a simple park or a store or somebody else's house. There is delays because we have emotional neglect from the caregivers, where this neglect is not intended. It was more for a infection control point of view. A lot of the caregivers, in order to prevent the transmission of different germs from the caregiver to the child, they would wear one of those infectious disease masks. And because of this mask, these infants rarely ever saw a human face. Obviously, there's the lack of one-to-one primary caregiver. And of big importance is the fact that children receive inconsistent responses to their basic health care needs. And that is because a lot of the nurses that took care of the children in orphanages worked on shift work. They worked 8 to 12 hours a day, every other day. So in the morning there was one mother, in the afternoon there was another mother, in the evening there was another mother. And that just changed every single day. So every caregiver had a different style to feeding, to bathing, to bedtime rituals, and emotions. So bathing was an ordeal for these children. It wasn't considered a playtime like it is here. A lot of the caregivers would just want to get through the bathing routine as quick as possible in order to put these children to bed. And how one caregiver would react to a child spilling water would be different from another caregiver. So the children never really had any consistent responses to what they did. And that's why there was always problems. Now, I would like to share with you some other reasons that some I've mentioned earlier why there is a delay in the developmental milestones of these children. We have one, the practice of swaddling of the infants, which basically is you take a little infant and you wrap them up nicely and tightly in a blanket. This way the arms and legs stayed bundled up tight and close to the chest and to the body. This way their arms don't get stuck and they don't move much. But because they don't move much, that's why they become delayed. We know about the lack of the nurturing physical contact with personnel. We know about the lack of stimulation. We have the practice of long naps. Children that live in orphanages tend to sleep for hours. And the reason that they do is because if the children sleep, then the caregivers can go about their business. We have the issue with chronic medical conditions and malnutrition, which obviously lead to developmental delays. We still have that lack of one-to-one attention. In the old days, there used to be like 20 or 30 children to one caregiver. Now it's much, much better than that is, but it's still not one-to-one. And another big problem was the practice of giving sedatives to the children in order to alter their behavior and make them drowsy. Now, this slide shows what the practice of swaddling is. You can see how the child is just basically wrapped up in a tight blanket. It cannot move its arms or its legs, and basically there's so much blanket in it that the child, even if he falls, will not get hurt. Now, some examples of lack of social interactions. We have the case of the caregiver caring for the infant and wearing that face mask in order to prevent the transmission of germs. The children do not see the caregiver's face. In order to prevent the transmission of germs from child to child, there is also the practice of keeping a sheet, a bed sheet or a blanket on the side of the crib. Now these children now cannot even see the other children in the orphanage. And we also have the lack of interaction during the feeding. You can see how in this picture you have the caregiver just looking around blankly on the walls and not looking at the child. In this picture you have the caregiver feeding the little baby, but she's not looking at the baby as a mother would and talk to the baby and coo and giggle with the child. What she's doing is she's just looking blankly at the walls, just getting her shift over, and she's just sticking a bottle in the child's mouth. There's no interaction whatsoever. Now, are modern day orphanages any better than they were years ago? Obviously, it's difficult for one person to take care of a lot of children in a group care environment. But at least we know today that the people that are in charge of taking care of these children at least love children. In the best case scenarios in modern day orphanages, at least it provides a physical, safe place for the children to live in. It provides the material needs of food, shelter, clothing, and medications if needed. They try to promote health and development in the children. We try to promote academic achievement, and they care about the psychological well-being of the children. But there is no replacement for a family, no matter how well-intended the orphanage is. Now, how have modern orphanages changed? They've changed by lowering the caregiver to child ratio. I've heard of cases where there were 20, 25, 30 children to one nurse. In modern orphanages, at least in the ones that have some finances, there's a 1 to 3, 1 to 5 ratio, one caregiver to 4 or 5 children. That's better. Caregivers are now instructed that they have to frequently hold, carry, and speak to the infant children. We have cases of volunteers just traveling overseas, dedicating their time to just holding these children and talking to them and stimulating them. Modern Russian orphanages are implementing a multidisciplinary approach to the care of the orphan children. They try to provide extra special services such as educators, speech therapists, physical therapists, musical therapists. There are better caregivers, there's medical professionals, physician, and support staff for these children. And it basically, these services are wonderful, but if there are finances there, the finances will reach these children. But if there are no finances, I could guarantee you those music therapists will not be found in the orphanage. Now, in modern day orphanages, in some countries, orphanages may appear as an attractive alternative to the desperately poor. Obviously, children that are placed for adoption come from, remember I said, poverty. Formula, medication, health care, clothes, food, shelter. These are luxuries to some people. We take it here for granted, but having a place to sleep is a luxury for some families. And some families that end up having children feel that they cannot provide any of the basic needs to their child, so they place the child in the orphanage in the hopes that one day maybe somebody will come and adopt this child and bring him to a better place, or at least they would get basic support in the orphanage. Sometimes an institution may be the only reasonable alternative in cases where adoption and foster care is not an option. Now, I'd like to leave you with some final thoughts on orphanages, international adoption, placements. Orphanages will never replace a parent. No matter how good it is, no matter where it is, there is nothing like a mother and a father and an intact family unit. Sometimes the orphanage is the only alternative that the family has for its child. We know that the severity of the medical conditions are directly proportional to however long the child lived in an institutional care environment. We also know that children grow poorly in orphanages, and that is because there is neglect and isolation from human contact. And we also know and have experienced that the medical health and the growth parameters dramatically improve post-adoption. This concludes this portion of the adoptioneducationclasses.com. What is it about orphanages that make it hazardous to the health of the developing child? Please proceed to the test-taking portion of the class in order to receive a certificate of completion. You may also visit us online at adoptiondoctors.com, where you can sign up for our medical e-zine. You can use our Ask the International Adoption Doctor question and answer service, and educate yourself by reading articles from our medical archive section. Thank you very much.